Stacy Steinbock is a professor in the School of Medicine, and Shannon Fitzgerald is in the School of Dentistry. And the two of them are working together on programming to help the doctors, nurses, dentists, and dental hygienists, students, and faculty become more aware of the unique health issues among LGBTQ individuals. So welcome, Stacy and Shannon.
Hi, Mark. Great to be here. Thanks for having us.
Glad you're here. All right, well, let's talk. I guess, first of all, we ought to tell our audience, what does LGBTQ stand for?
Sure, I can do that. So that's lesbian, gay, bisexual, transgender, and queer. And that's a word that might have kind of a hard impact for some people because it's been used in a derogatory way in the past. But young people who are in the LGBTQ community have reclaimed that word queer to imbue it with good, positive meaning now.
So it's PC to use that term, right?
It is if someone uses it first. So if someone identifies that way and they use that term,
you can't call that person that name. Okay.
Yes. So I would still caution people to use that word only if people are already using that to describe themselves.
All right. That was Stacy, by the way. Shannon, what are some of the things that are going on at the School of Dentistry to train, I guess, dentists in maybe how to better deal with this population?
Absolutely. At the School of Dentistry, we're in the first year of what we call the cultural competency. It's a two-part competency. There is a practical in the second year of dental school. It is the kind of training lectures in the second year of dental school where they teach about the theory of cultural competency and clinical tools that you can use to treat anybody who sits in your chair. Second part is in the D3 year, and that's what we've actually finished the first round just this semester, just last week, which we're really excited about. But they get to sit down with standardized patients who are essentially actors who are portraying patient cases to challenge the students on certain topics. So specifically to the LGBT, we had a transgender case that we wrote up, and they have specific challenges like what happens when your patient has a past of discrimination of healthcare providers, and what kind of challenges are they bringing to that chair with them beyond simply having to get a tooth worked on. Right. Also, they have mistrust of providers, past discrimination, just being able to approach somebody who is withholding some information.
Knowing what to say
exactly.
is a big one because you want to be politically correct. You don't want to offend them. So is that part of the training that you're giving these dental students about here's how to approach a transgender individual?
Absolutely. One of the most important things I think that we've taken out of the case is that introduction. If you come into the room and you have somebody on the in the health record who is marked as a male and they're presenting as a female, how do you address that? So one of the great things
that's tricky.
Yes, it is tricky. And one of the great things that we have to prepare our students is the LGBT health and wellness certificate that we have on the HSC campus, where they're talking about these really important issues and being able to prepare our providers with questions like, what is your preferred gender pronoun? Or how would you like me to address you today? And be able to get that from the patient perspective in a comfortable, respectful way.
Don't be afraid to ask the question.
Mm-hmm. Right? Absolutely. And that's one of the questions I get a lot around transgender patients is it okay to ask? And I always let people know, yes. And there are respectful ways to ask, and here's how you would do that. And I love that question. How would you like to be addressed? Because, for example, my grandparents might really prefer to be addressed by last name, right?
Right.
Whereas I'm very comfortable with a first name. There are also people who have nicknames for lots of important reasons. So, right. So a great question for a lot of patients, which is simply, how would you like to be addressed?
We're talking with Stacy Steinbock from the School of Medicine and Shannon Fitzgerald from the School of Dentistry. And we're talking about these LGBTQ initiatives down on the health sciences campus at the University of Louisville and training those students. What are you doing in the medical school as far as training students on how to deal with these same issues that the dentistry students are dealing with?
Right. So we've taken different approaches in the two schools. I love both of them, and I'm learning a lot, actually, from what Shannon's doing in the dental school. In the medical school, we have some really brave leadership from our Dean Gansel in our medical school, who 2 years ago gave us the thumbs up on being the first school in the nation, the first medical school to pilot LGBT competencies within our medical school's required curriculum. And that's something that was written on the national level through our Association of American Medical Colleges, the AAMC. And we're the first school to put them into play in our curriculum. They're woven throughout, so they're not put into kind of a special day or a 2-hour lecture. It's simply looking at our curriculum and where does it need to be inclusive that it hasn't been. and then working with our faculty to include that information and make sure it's accurate.
So has that involved having to rewrite some manuals and some textbooks and those kinds of things, or not?
There are actually textbooks that are rewritten in order to include that information. Fenway Institute has one of the best textbooks that is inclusive of LGBTQ folks. In the classroom, what it looks like is that, for example, when you're teaching about hormones and the use of hormones from a kind of a pharmacological standpoint, we talked about hormones that would be used for men and women in many different situations, but we never talked about what that would look like for a transgender patient. So that was simply kind of left out of the curriculum, and now it's included in the curriculum because that's an obvious place to include it. Also, the language has changed. So as we're taking a sexual history, we want to make sure that we're really using inclusive language and not making any assumptions about who we're talking with and what sexual practices people might be engaging in.
Why do you two think it's important that U of L have these programs that are training students and faculty on how to deal with folks with different sexual orientations? Why do you think it's important?
I think it's very important in our clinic. So one of the unique parts of the School of Dentistry is that we have an active patient clinic. And in the last 2 years of dental school, our students are treating patients in our community every single day. They see up to 500 people in our clinic on a daily basis, which is really wonderful. And we also have a great diversity of patients in our clinic. So we want to make sure that every time they come in, they feel like they're valued as a patient and they want to come back, because our appointments are a little long and you have to be patient to go to the dental school. But we want to make sure that they feel like they're part of our patient family. So when we have people from the community who have experienced oppression, who have experienced social stressors like the LGBT community, we want to make sure that they feel like they have a home, a dental home here at the School of Dentistry and across the HSC campus.
And Stacey, you want to tackle that one?
Yeah, I would say I would go back to our core values here at U of L. And our core values that are here at U of L and reflected in our medical school and in our dental school is that we really care about the diverse population of patients that we see every single day, and we care about our community as good community partners. And LGBTQ folks are part of the fabric of life. They're the patients that we see, they're in our families. And so the medical school has really said, with this curriculum and the dental school as well, we care about our patients. And even though this can be a controversial point for some people, this is in fact a part of our community, and we want to be providing great care to all people, inclusive of gender and sexual identities.
And when it comes to the issues of dealing with those patients and talking to those patients is one thing, but dealing with the medical issues may be a little bit different. I understand, a transgender person obviously may have different medical issues than I'm going to have. But for the most part, aren't we all the same? So what do you have to tell the medical school students and the dental school students about dealing with them medically, or as a dental hygienist perhaps working on some teeth? Aren't their teeth the same as mine?
They are, but we have, I think when we break it down, when we're talking about the LGBT community, they are suffering with health disparities. So those are because of the social stigma against them. You have issues with access to care. If they can't find a healthcare provider that they trust and that they can build a relationship with, they're going to leave their dental treatment on the back burner. So in the long run, that has really poor health outcomes. And so really what it's about is building that relationship and being able to say, yes, we are a trusted network of healthcare providers that can give you the care you need so that you can be like the rest of the population that doesn't have that social stress, that minority stress, and stigma, so that they're able to access care, have better health outcomes, and not have to be worried about, progressing to something that becomes uncontrollable.
Right. That was Shannon Fitzgerald from the UofL Dental School. We're also talking with Stacey Steinbock from the School of Medicine at the University of Louisville. Since we talked about access and finding a doctor or a dentist that would treat you if you're transgender, gay, bisexual, whatever, is that a problem? Is that really a problem? And if so, how are you tackling it?
You would be surprised, Mark.
Really?
I get a call almost every single day of someone asking me for help finding an LGBT-friendly and competent provider, whether it's a dentist, a pediatrician, a primary care provider. It is really an issue. And, I know that when I moved back to Louisville, that was kind of one of the first questions I asked, because I also wanted to find somebody who is LGBT friendly. I've had some poor health care in the past. And
poor health care or insensitive health care?
Both,
Okay.
actually. Yes. So I identify as bisexual, and I had And when I had my first girlfriend, I was about 21 years old, and I saw a provider, a doctor, who told me that I had absolutely no need to worry about STI transmission, that was impossible. And, that could have had some really serious outcomes for me. Luckily, I'm a pretty informed consumer, so I did my research and said, wait, I don't think that's right.
I don't think that's true.
I don't think that's true. And I had another who simply blamed a healthcare issue I was having on the fact that I was bisexual and said, that's your problem. You fix your head, you're going to fix what's going on with you. So, both things are possible for sure.
So then what's UofL doing to try and hook up and link up these different individuals with doctors and nurses and dentists that provide that kind of care and are okay to go to?
Yeah, well, we have an exciting new initiative, actually, and this is it didn't initiate with UofL, but we are the first to take them up on it. So IU Medical School started outcarehealth.org, and this is a website that has a database where healthcare providers who are LGBT friendly and competent can sign themselves up and say, this is a population I care about. I want to work well with you. Please come and find me. And they are really putting out the welcome mat in a way that most LGBT folks have not experienced. And so UofL is one of the partners here in Kentucky of helping people get signed up and doing that recruitment. So for folks out there who are listening to this, and this is a population you enjoy serving and you have competency serving, please sign up there so that people can find you. We have about 20 people signed up now, and I'm sure there are lots more.
20 people meaning providers, physicians, and dentists.
And dentists,
and they all in the Louisville area?
Most are in the Louisville area, but this is a statewide database, so we'd love to find people out in the counties because that is certainly a need that we hear about all the time.
And they can just go to this outcarehealth.org website to sign up, or do they need to track you down? How's
nope,
this work?
They can do it themselves, so I do not have to be a gatekeeper for them. So by all means, they can go there and they can sign up in about 3 minutes. It's a very simple process.
All right, we've got about a minute left here. What would you tell folks about the University of Louisville taking the lead on this whole this whole area actually of healthcare? What would you tell folks and why they should be proud of the University of Louisville and what has happened with LGBTQ care?
I think that one of the most important things is that we're able to reach across the healthcare disciplines and work together to say, these are the patients that we need to serve. We need to serve everybody at the highest quality and level of safety possible. And so at the dental school, we were able to reach across to the health science campus. We reached over to the Office of Diversity and Inclusion, the LGBT Center, medical school, nursing. We had everybody involved in this competency, and I think that's really important. It takes all of us in order to achieve these health outcomes for the people who need it most.
All right, very well said.
And I would say I feel so proud to be here at UofL. I work for the LGBT Center, and I work for it over on our health sciences campus, and I'm embedded in our medical school. And the way that our school has supported our LGBT Center, which is far beyond many other schools, particularly in the South, is a great point of pride for us, that we're doing more for our students and to support our community than many other schools. And it's really made us one of the most LGBT-friendly, welcoming, inclusive universities in the South.
All right, very good. Stacey Steinbock, Shannon Fitzgerald, thanks for being on the program.